Good evening. My name is Kathy Lemaster, and I'm the Human Resources Director at Brown Hospital. This is a proposal for communication and writing skills training for our employees. Brown Hospital employees are in need of extensive writing and communication skills training. Employees scoring low on an assessment must take an online course offered by North Carolina State University. Upon completion, these employees will be better able to effectively communicate. A serious communication error occurred in our facility on February 9, 2018. Upper management made the decision to give all employees a business writing assessment test the week of March 5th through the 9th, also of 2018. The scores were administered by ACT Incorporated, and they administered the business writing assessment scores. The scores were professionally graded and evaluated. 800 of our employees scored at a level that can seriously interfere with communication. This is 40% of our workforce, as reflected below. If you look at the table, the light blue 20% and the dark blue 20% reflect score 1 and score 2, which are the lowest scores on the business writing assessment test, and those are the scores that can seriously interfere with communication. Scores 3, 4, and 5 are reflected in the 10%, and the 40%, which they are effective communicators. But the two 20%, the light blue and the dark blue, they are ineffective communicators, and they need to be trained. Research suggests communication problems put patients and hospitals in harm's way. According to Crico Strategies patient safety experts, communication errors happen when information is not conveyed well, or when it's unrecorded, misdirected, never received, never retrieved, or ignored. Crico studied 23,000 medical malpractice lawsuits, and over 7,000 involved miscommunication. And that is reflected in this graph. A full 30% of the cases involved miscommunication. And that 30% can be eradicated through effective communication and writing training. Poor documentation is most apparent when transferring patients to a skilled nursing facility. According to a study commissioned by the Journal of Geriatric Society, nurses cited multiple errors in problems with medication orders, little patient psychosocial functional history, and inaccurate current health status. The cost of bad writing. Poor writing costs time. When writing is illegible, it takes time to decipher it or to contact the communicator to verify what he was attempting to articulate. The same is true for poorly written instructions, emails, reports, and memos. Poor writing can also be dangerous. The negative effects of poor writing are obvious when it comes to patient care. Ineffective communication regarding a patient could lead to improper care or even death. But there is a solution, and that is mandatory enrollment of Brown Hospital employees scoring low on the business writing assessment in the Communications and Writing Skills course. North Carolina State University offers an online course entitled Communication and Writing Skills. The course is designed to help employees become effective and persuasive communicators. Upon completion of the course, employees will be able to use newsletters to communicate, gain confidence and improve communication skills, understand the fundamentals of effective writing techniques, write, evaluate, edit, and format basic documents within a professional office environment, effectively communicate and convey a clear message, and use basic negotiation skills in a variety of contexts. The registration and time frame is the course will begin on June 1st, 2018, and it will end on August 31st of 2018. Employees are expected to register by May 15, 2018. The cost of the course is $2,595 per participant, and although this is a significant investment, Brown Hospital does have a continuing education fund that will cover the cost. Concise writing will improve our service in every capacity, including inter-office communication and also our communication with vendors and outside resources. In conclusion, it is crucial that all employees of Brown Hospital be well versed in writing and communication skills if we hope to compete in the 21st century marketplace. I highly recommend that Brown Hospital enter into a contract with North Carolina State University for the communication and writing skills course to be taught to Brown Hospital employees. Thank you for your time and consideration.